say farewell to our YouTube friends, we will move on to a Q&A section for press only. And at that time, we will be showing your screens where you will be able to ask questions. Also, those of you on Zoom, please select the language of your choice, English or Japanese, by clicking on the icon under your screen. Now that we have that sorted, let's get started. First, I would like to introduce Mr. Akio Okawara, the President and CEO of JCIE, which is one of Japan's leading foreign policy institutes and one of the two organizers of this award program. Mr. Okawara, please.
Thank you, Nobuko. Ladies and gentlemen, it is my honor to welcome you today as we announce the winners of the inaugural Healthy Aging Prize for Asian Innovation. This prize was created by JCIE and AREA as part of our work under the Asia Health and Wellbeing Initiative, known as ARWIN. ARWIN was launched by the Japanese government in 2016 to promote regional cooperation on a range of issues related to fostering vibrant, healthy societies where people can enjoy long and productive lives. JCIE and AREA have been carrying out a number of projects to help achieve that goal, and the Healthy Aging Prize for Asian Innovation is one of them. This award was introduced at a pivotal time as Asia now faces rapid aging, and therefore the objective of this award is to help identify innovative approaches to aging throughout the region, to acknowledge and encourage the organizations implementing those approaches, and to disseminate those models throughout Asia. In short, the basic emphasis is placed on learning from one another in the region. Applications were received between January and March this year, and we were overwhelmed by all of the amazing innovations that we received. We had 134 applications in all from 12 countries and regions around Asia, and the work that each one of these organizations is doing is incredibly impressive. We were truly encouraged by these results, which showed that innovative ideas can come from many places and various sectors, and also show the potential of maximizing a multidisciplinary approach, which is indispensable in tackling population aging. In order to shed light on these hidden gems in the region, we as the organizers hope that this award program serves to recognize and validate their work. As you know, not long after we started receiving proposals, the pandemic began, and that meant that we had to change many of our plans. The selection process was done via Zoom instead of in person, and our plans to hold a conference this month where the winners would receive their awards had to be postponed. Nevertheless, we are very happy that all of you are here with us today, virtually, to help us celebrate these wonderful innovations. Thank you very much.
Thank you, Mr. Okawara. Now it is my pleasure to introduce Professor Hidetoshi Nishimura, President of AREA, an international organization that supports the regional economic integration and development among 16 East Asia Summit member countries by providing research and policy recommendations. Professor Nishimura, can you please share your thoughts on this inaugural year of the program, please?
Thank you, Nobuko. Good morning and good afternoon, everyone. First, I would like to sincerely congratulate all the teams and the individuals who have participated in this inaugural award program. As Mr. Okawara has mentioned, many inspiring applications were received, and the competition amongst them was very intense. The selection committee members, including myself, spent a great deal of time reviewing the applications, and it was a very tough job to decide on just 3. We also experienced the global pandemic of COVID-19 during that time, where we are strongly reminded of the significance of innovation to adapt to the new normal and the importance of community efforts in maintaining social bonding. Reading these bright ideas in the midst of the pandemic gave me encouragement, and I must say, each and everyone deserve to be honored. So I would like to take this opportunity to thank all of the applicants. Thank you very much. Now, I'm sure we are all excited to hear the voices of the 3 grand prize winners. So I would like to hand it over to you again, Nobuko.
Thank you, Professor Nishimura. With that, let's get to the really exciting part, the 3 winning innovations. Ladies and gentlemen, it is my honor to present the winner of the grand prize in the category of Technology and Innovation. The Buddy Home Care Program, an innovation of the Foundation for Older Persons Development in Thailand. We will now play a short video.
I told them ne ye sakku do ma da si blue bana ko na ga de no le ni hela ba ko pha le re ke te le po ko ta te blo nya I pra da ye ta mo pho ko na ga de pa ke rực le che ma ta ma di so ke ke blue le pra ho ko pho ko cha te pho a tho kha chu nya pa a go tin lo ta blue.
On behalf of Foundation for Older Persons, it is our privilege to receive such a great and important prize this time.
Buddy Home Care มาเจอภาษาโฮเลขออย่าเนาะแล้วหมอป้าเชิญมาโลตาโตบ้า Buddy Home Care มาเจอตาสูตาสวยเวลาเฮมาโลตาบักคาร์กว่าปอสบาเนาะแพ้เวลามาโลตาโปรทอยคันนี้ Buddy Home Care กิดแตะกระต่อพายแล้วตาพี่ตามาเอาไว้มาโลตาโปรวีอันนี้บัตรพิตมาเลือกอะไรเลือกอากาศหัวเนาะคิมีแต่มีบัดดี้โฮมแคร์มาเจอปอสุปราเลือกแบบพอบานะเนาะแฮกแล้วเลือกที่สอบภาษาโฮสิทธิภาเวลามาโลตาโลนี้เวลาสัวอาตาสิญาณเปิดสิทธิภาเวลาและลอกว่าปอสุปราเลือกแบบนั้นแบบพอสิทธิภาเวลาเฮเวตานาเปิดเฮเวลาอาตาสิญาบักคาดอลเลตากว่ารอช่วยก็จะตาโอชูโอเคดอมาเจอกระแชกระชอเด็กขอหล่อปูก็เวกวอลเลเด็กขอหล่อปูสิทธิภาดิซอกระแชกระชอดิซอแกตัดละอับลือแล้วพอสปาก่อนนี่เหรอ
Buddy Home Care team initiate of the application to collect the information of the older people that they visited, mostly of the older people who need help or assistance at home. In case of the caregiver, they have problem, they can consult with the board of advisor right away. This is very important for the social impact. It's both sides of the information that they can transfer to, and the social impact in greater side of the social impact would mean that the caregiver, they are the Hill tribe, the people from Hill tribe area. So when we provide them opportunity for further education on how to take care of older people by using application, they can work with the government healthcare or community health worker in their community. This is because the health workers in the area, they don't understand the dialect of the Hill tribe people, what they are used communicate among themselves. But the caregivers, as they are the people from the Hill tribe, they understand, so they can be the translator for the healthcare team.
แต่ก็แต่แค่เลือกหอกโคเลยคืออาดูมาเนาะยันนาลูกปลาก็มาเจอก็มาเรียนหอเกแต่ก็แต่แค่ดิโซเวดาเกิดรอการรอเซนเนาะดิโซนี่ไม่กว่าเลยยังก็จ้าแต่กายนี่ยังแก้ภาษาโฮเลอขอหน้าแต่กาขอล้ออย่าเลิกขาชูล้อปูควีนี่ชั่วโมงจะป้าตาโตบาจะแก้ปลาพอโพอย่าโพปลา lơ tên này bà ta chưa có tỏ là người lên tập phi lô mà lô bà mò cha mùi tên ní lấy cho mà lô tập pro ý nế ta có ta khe xe tập hà mà đi soi giờ ổn lấy sao có bộ thó bộ đi soi giờ cứ mà đi chân lé đi soiเลยก็มาเจอta có ta khe sựผ่าđi soi về là cô gà lo màเจอแบบปากคือทอเนี่ยยันหน้าสุปากเตอร์แล้วปากก็ta có ta kheก็ta gàที่มีนะยาปากก็กะเดะเปิ้นไม่ซีทอเนี่ยเปิ้นตะก็ตะแคแล้วเปิ้นโตก็บาดละปุคีดอเปิดแก้ดื้อถอเนี่ยแกตาเลิกเปิ้นก็โอ้ละสูละซาเลิกเวลาแฮทอตะหมุมมาเซอร์บาซาเลิกภาษาโฮแล้วก็ตะก็ตะแคก็จะแต่ปูก็ปูได้ว่าตะริฮอคนเนี่ยยันหน้าสุปาเตอร์เลนายาก็งาปมาเซเนาะตับลือ
We plan to use this innovation or application to collect the information of the older people under the Older People Association outside Chiang Mai and the other part of the country that we plan to. So this will enable the Older People Association have the baseline information of the older people and that they can plan to conduct the activity according to the problem and needs of the older people.
Professor Nishimura, your comment, please.
Congratulations, Foundation for Older Persons Development. The selection committee was very impressed with Body Healthcare's unique approach, leveraging technology, a smartphone app, to create a community-based healthcare monitoring system that solves multiple problems. You are addressing both the lack of care services for older people and the lack of job opportunities for impoverished youth from the indigenous hill tribes, and at the same time offering a way to share health information between older people, care providers, and family members. The technology itself may not be the most advanced that we saw among the many wonderful applications, but this innovative application of a relatively simple technology was what earned you the grand prize.
Thank you, Professor Nishimura. The next winner, the grand prize for community-based initiatives. HelpAge International in Vietnam for their intergenerational self-help club model. Congratulations. We will now play a short video.
We are very happy and honored to receive this grand prize. And when I talk about the we here, I mean not only HelpAge, but also our local partners, including the Vietnam Association of Scientific, the Vietnam Women's Union, who work very closely with us during the last 10 years in this model, the donors who supported us in various projects, and also the government of Vietnam who support and also endorse this model into the national model. And especially, I would like to mention nearly 3,000 intergenerational stand-up clubs and their members in the communities. And it is a great recognition, and it's more meaningful when currently Vietnam is developing the second phase of the intergenerational stand-up clubs replication project in the country. And we are on this occasion, we would like to thank the organizers very much for this great initiative because it helps us to be more confident in the way forward. So what is the intergenerational stand-up clubs? It is a community-based and voluntary organization comprising of the people from diverse backgrounds. Most of them are older people, women, people from vulnerable circumstances. And the clubs are self-managed and are multifunctional. It covers health, community-based care, livelihood, lifelong learning, cultural and social bonding, and social participation, and also the resource mobilization to ensure the sustainability of the organizations. And very important to mention here is that the clubs are totally sustainable, both financially and technically after 1 or 2 years receiving the support. And this is the community platform where people, both older people and young people, men and women, people from different backgrounds to get together and help one another. And joining the intergenerational stand-up clubs, most of the members reported that they feel happier, wealthier, healthier, and feel more empowered and also more confident. So currently, Vietnam seeing the great benefits of intergenerational stand-up clubs is developing the second phase for the intergenerational stand-up clubs replication project. And during that process, HelpAge will continue to develop the capacity of our local partners in the model replication. At the same time, we also work with the intergenerational stand-up clubs and Vietnam Association annually to improve the model so that the model can better meet the needs and the wants of their members and community members, especially those of the older people. So as you know, that most of the older people in Vietnam as well as the Asian countries prefer to live or to age in their own communities in their later life. That's why we think that the countries should invest more resources in that kind of community-based interventions. And the intervention can be successful only when it addresses the wants of the people, have the people's participation and ownership. We should trust the community and empower the community to identify their own needs, their own problems, and come up with their own solutions. And during the process, the role of the older people organization and the role of the government, both national and local, are very crucial to ensure that the interventions can reach more people and more sustainable.
Professor Nishimura, your comment, please.
Congratulations, HelpAge International in Vietnam. Our selection committee recognized your work as outstanding project that has been continuing and expanding since 2006. Your model has proven to be sustainable and has been replicated in many other areas of Vietnam. Now, we understand HelpAge is conducting training in other countries to share the model with even more people. That broad impact of the model and the fact that it not only provides healthcare and social engagement, but also empowers older people through skill development and income generating activities are the key reasons why you were selected as a grand prize winner.
And finally, the grand prize in the category of supporting self-reliance. The city of Komagane, Japan, for its program on preventing stroke recurrence through a hospital local government partnership to support patient self-management. Congratulations. We will now play a short video.
皆さん、こんにちは。長野県駒ヶ根市長の伊藤雄三です。この度、駒ヶ根市が昭和医南総合病院とともに取り組んだプロジェクトを国際的に評価していただき、ありがとうございます。お礼を申し上げます。駒ヶ根市は東京から車で3時間半、日本の中央にあります。2000メートル級の山脈に挟まれた 人口3万2000人の美しい町です。高低差日本一の駒ヶ岳ロープウェイがあり、高原の爽やかな自然を求めて多くの人が訪れています。晴れて澄み切った日には日本一高い富士山、第2位の北岳、第3位の愛の岳を見ることができる絶景の観光スポットもあります。今回の取り組みは病院と市が一緒になって地域の課題であった脳卒中患者の再発・重症化予防に取り組んだプロジェクトです。地域全体で問題意識を持ち、手順を踏みながら関係者を巻き込んで統合的なサービスを作り上げていった取り組みとして意義は大変大きいと考えております。超高齢社会を迎え、人材や財源が限られている中で、地域全体で住民の健康意識を高め、セルフマネジメント支援という形を通じて専門職が効果的に関わる取り組みです。高齢社会を迎えるアジア全体に大きな示唆を与えるのではないかと感じています。今後、さらに取り組みを改善し、健康都市を目指していきたいと考えています。ありがとうございました。
皆さんこんにちは。昭和医南総合病院院長の村岡伸介と申します。この度はこれまで駒ヶ根市と一緒に取り組んでまいりました脳卒中再発予防事業につきまして国際的に評価を受けましたこと、大変嬉しく、そして光栄に存じております。さて、昭和医南総合病院は4市町村によって設立運営されている自治体病院です。私は当院赴任時からこの地域の脳卒中診療に携わってまいりました。その時感じたのは、最初の1年間をうまく再発せずに乗り越えられれば、再発率は低くなり、長く安定するということでした。そこに駒ヶ根市の担当者から脳卒中死亡比が全国平均や長野県の他の地域よりも高いことを知らされました。当院1年分の入院患者データを調べてみました。実に再発率は 20.5%、そして再発例の 30% が最初の1年以内に再発していることが分かりました。この最初の山を低くできれば再発率を抑えることができると考えました。今回、駒ヶ根市と脳卒中患者に対するセルフマネージメント支援事業を行いました。血圧管理や服薬管理、食事、運動といった生活管理を患者任せにすれば出されなくなることは明白でありました。そこで入院中から患者教育用の脳卒中ノートと活動量計を使ってセルフプランの作成支援を行い、退院後1年間、病院看護師や管理栄養士が本人と面談をしてセルフマネージメント力を高める取り組みを行いました。事業の結果です。平成30年度から1年以内の再発率が低下をしています。また、事業参加者のうち1年以内再発例は1例のみにとどまっています。我々は事業の効果があったと評価をしています。脳卒中は生命に関わる疾患ではありますが、後遺症を残しながら地域に戻って生活を再開する疾患に変わってきています。その点で、地域包括ケアシステムの構築にとって重要な疾患であると考えています。最後に、国や地域により、その問題の在り方、取り組み方、到達目標は異なると思いますが、高齢化が進むアジアという点で、この事業を参照していただけると幸いに存じます。本日は大変ありがとうございました。
Professor Nishimura, your comment, please.
Congratulations, Komagane City and Showa Inan General Hospital. Sorry. This category of self-reliance is intended to focus on innovations that help people to recover or maintain their ability to carry out daily function. So the committee found your innovation dealing with patients recovering from stroke is an excellent example. The project success relied on close collaboration between the municipality, the local hospital, and the patients themselves, as well as patients' personal physician and family. This collaboration was one of the aspects of the project that most impressed the committee. And I think it is particularly relevant during a crisis like the current pandemic that requires cooperation between the local government, medical institutions and professionals, and the community itself. We are also impressed by the potential. This innovation has to spread on older people's ability to understand their health situation better, set their own goals, and manage their health more proactively.
Thank you very much. Now that we have met these three inspiring grand prize winners, we would like to share some reflections on the inaugural year of the prize from two members of the International Selection Committee. The first is the chair of the committee and one of Japan's top leaders in the health field, the Honorable Keizo Takemi. Professor Takemi is a senior member of parliament in Japan's House of Councillors, and he also serves as the World Health Organization's Goodwill Ambassador for Universal Health Coverage. He is also a senior fellow at JCIE. Professor Takemi, please.
Good morning and good afternoon to all my friends in Asia. The first and foremost, I would like to congratulate the three Grand Prize winners of the very fast Healthy Aging Prize for Asian Innovation. Congratulations also to all the teams and individuals who participated in this challenge and showed us their creative approaches to addressing the important topic of the population aging in Asia. 134 the bright ideas were submitted from various countries in Asia, which I believe is a great achievement considering this was the first year of the award. I would like to extend my utmost gratitude to all the applicants who took the time to submit their ideas. It was very encouraging to see from the applications that there are many outstanding practices throughout Asia, which are not only providing the care and support for older people, but also protecting their rights and dignity. I am determined that this award will be a platform for information sharing, helping us work towards a vibrant society where people can enjoy long and meaningful lives, contributing to the region's sustainable growth. Given that Asia is a highly diverse region, with socio-cultural differences and the varying economic standards, there isn't a single solution for how older persons could lead happier, healthier, and more active lives. But this award has proven that the multiple solutions are within reach and could come from anywhere and anyone. I cannot stress enough the importance of innovation in addressing the various issues pertaining to population aging. I myself have learned a lot from your ideas And I'm glad we have taken this step in working towards promoting healthy and active aging in this region. To the 3 organizations who won the Grand Prize, congratulations once again. Although this time we have to resort to a virtual event due to the global situation of the COVID-19. I look forward to the day we could hold a grand award ceremony to present the trophy to you in person. To all the applicants, thank you for your valuable contributions, and I look forward to seeing many more outstanding works next year in the 2nd Healthy Aging Prize for Asian Innovation. Please stay safe and healthy.
Thank you, Professor Takemi, for your enthusiastic remarks. Next, we will hear the thoughts of a second member of the selection committee, Professor Tengku Aizan Hamid, who is the founding director of the Malaysian Research Institute on Aging and president of the Gerontological Association of Malaysia, among her many other posts. Professor Tengku Aizan, please.
Very good morning to all. My name is Tengku Aizan. I'm one of the panel of international judges for the Happy Award, and I would like to share with you what Happy Award is all about. I think this award is very, very appropriate at this moment because a lot of Asian countries are facing aging and trying to find out how best to cope with population aging. And Japan, being the aged nation, the most aged nation for the moment, and has experience going through the aging process from early aging stages to now being a super aged nation. I think we can learn a lot from what Japan experienced, and also we can, as countries in this region, will share together what needs to be done in our situation, because population aging in Asian countries are at different rates, and we need different strategies. And by having this prize, we can share what has been done in other countries and how we can use these as examples that we can adopt and adapt in our countries and within the situation that is relevant to us. So let me tell you about the membership of the judges in this award. We have a 5 international panel of judges from Malaysia. I'm from Malaysia. I'm one of them. We have from Singapore. We have from Vietnam. We have from Thailand, and we also have from Japan. So we, as a panel of judges, had very difficult time to really select the best out of so many innovative, so many services that has been on the ground, and it's really difficult for us to really come up with which one is the best, because many of these projects are very good. Let me close this conversation by congratulating all the grand prize winners for a very good initiatives on the ground, and I really look forward to more entrants from for the next year's award, because even though this is the first time it has been broadcast, we already have received over 100 over entrants, and I'm sure a lot more will be submitting, because of the realize that this award is a very important award for our region, and I'm looking forward to getting more submission next year. So all the best for the next year's entrance, and congratulations to the 3 grand prize winner for the first inaugural Happy Award 2020. Thank you.
Wonderful. Thank you very much, Professor Tengku Haizan, for your comments, and may we wish you Eid Mubarak. As Professor Tengku Haizan mentioned, there were many exceptional applications. We would also like to draw your attention to 7 innovations that the committee felt were also truly excellent and deserving of recognition. In the category of technology and innovation, the second prize winner is SmartPeep, based in Singapore and Malaysia, for their SmartPeep AI elderly sitter system. In the community-based initiative category, there are 4 organizations that tied for second prize. In alphabetical order, they are Buangito Municipality in Thailand for their Strong Model Program, Gwynfi.Inc. for their Housing Complex as One Big Family concept, Help Without Frontiers Foundation for Oldie Project in Thailand for their For Oldie Grandpa Grandma Shop, and Indonesia Ramalansia, the IRL Foundation for their Indonesia Elderly Friendly Community Program. And finally, in the category of supporting self-reliance, we have 2 second prize winners. The Korea Association of Senior Welfare Centers for their KB Good Memory School, a senior center-based dementia prevention program, and the Vietnam Association of the Elderly for their Bright Eyes program for older people in Vietnam. Congratulations to these great organizations. You can learn more about all of these projects by visiting the AWIN website after this event. And that concludes this portion of the award announcement. Congratulations once again to all of the winners for their amazing work that they are doing. For those of you watching on YouTube, we thank you for joining us, and we hope that you will visit the AWIN website at awin.org to learn more about these and other great innovations. To the members of the media, please stay logged in on Zoom. We will start the Q&A session in 3 minutes, at which time your screens will become visible and we will begin taking questions. Once again, thank you very much for joining.